Hey everyone, Hospice Nurse Julie here, just in my bedroom in Southern California. Thought I'd do a live real quick. I'll record it, probably around 20 to 30 minutes, waiting for people to come on and ask me some questions while we wait. If you're new to my channel, I talk all things death and dying related. I'm here to help educate about the death and dying process and decrease your fear, hopefully through education. I've been a nurse for 15 years. I was an ICU nurse for many years, and now I've been a hospice nurse for about 6 years. And I took to TikTok mostly about a year and a half ago to educate, and now I've just branched out to other channels. And YouTube is my favorite, to be honest. So people are coming in. Hi, everybody. Greetings. Hello. Thank you for coming in. Okay, so I already got my first question that I love. It's from Carla Cupcakes. My father-in-law died 3 months ago today. Wow. That's not very long ago, Carla. Thank you for being here. Sorry for your loss. And the night before he slipped into a coma, he was agitated and restless. Is this normal? So their agitation and restlessness is normal, I will say, at the end of life at times. Not everybody will experience this, not in the slightest. But if someone is experiencing it, it is normal. But I, as the hospice nurse, if I was the hospice nurse, I would be trying to figure out why that's happening. So are they in pain? Are they constipated? Do they have to urinate? Is something going on that's making them restless and agitated? So I would look at those things. If I couldn't find anything that was causing the agitation or restlessness, I would consider them terminally agitated, which we're not sure why that happens, but it does happen sometimes. And I would have tried to medicate until he was no longer agitated and restless. So yes, it's normal. And if I was there, I would have, not like me. I mean like as a nurse, not as a family member. Like you did nothing wrong. But I feel like in general, with terminal agitation, as hospice providers, we need to be managing that and taking care of it. Do the dying know they're dying at the end? Melissa, I think they do. But of course, we can't say for sure. Now, if someone's on hospice and they've been slowly declining this whole time, yes, I do think they know, because I think they can tell. Even when I talk to them before they're unconscious, they'll say, I can tell I'm getting weaker. I can tell them I'm getting closer. So I've had people tell me that. I don't know if people know if it's sudden or things like that, but I do think people know they're dying. Have you seen ghostly activity? I have not. Thank you, Lord, have mercy. I believe in spiritual things and spirits, and I love like spooky stuff and Halloween and horror movies and paranormal things. I think it's interesting, but I also would not want to see a ghost. So I think that's why they don't show themselves to me. Thank you, Tara. And thank you for being a hospice aide. That's amazing. Hi from Australia. Hello. Hey, everybody. So great to see you. Hey, Julia. Can you expand about throat cancer with a total laryngectomy? Okay, so it's really hard to give like specific details. I want everyone to know what I'm talking about, like certain types of cancer. It's coming from a hospice perspective. So someone who works with that type of patient with throat cancer, which I have worked with many of them in the ICU specifically after they've had total laryngectomies. But on hospice, I haven't seen like technically someone with throat cancer all the time. I do feel like people with throat cancer usually can live quite some time after the surgery and after treatment. And they may have to, I'm not sure if they still have their voice or not. And my uncle actually had throat cancer. So there's usually some pain. There's usually some irritation with the throat, and eating's hard and drinking's hard and all that stuff is hard. Speaking's hard. But but I actually don't see many people on a hospice with that specific cancer. And if I do, it's usually because they've already had it for a bunch of years and now they're coming onto hospice. So that's what I can tell you in a general way. Um, the ones that I can really be specific about is usually because I see them all the time. I see that type of cancer all the time. And I will say I don't actually see throat cancer all the time. Thank you, everybody who's willing to show up and ask me questions and listen to my channel. Thanks, Jay Blokes. Hi from New Zealand. Judith, I was just on a radio show in New Zealand just yesterday or the day before called Big Hits, I think. Oh, thank you, Judy. Thank you, Susan. Let's see what else. Question: have you ever dealt with a patient that was scared of hospice, the hospice process, and was reluctant to go through with it? And if so, um, how did you walk the walk? Maybe. Yeah. So I run into people. I feel like, oh my gosh, so many. At least once, maybe not once a week, but maybe once every 2 weeks. There's a patient or family who are kind of anti-hospice or just anti wanting to believe that they may be at the end of their life. Just to me, what I love about my hospice company specifically is it never feels, oh, it says connection's unstable. Please wait while we reconnect. I'm going to give it a few seconds because it said my connection was a little iffy. So the question was, have I ever dealt with a patient who was scared of the hospice process and reluctant to go through it or reluctant to come on service, meaning like elect to go on hospice? Yes, this happens all the time. I would say once or twice a month at least. The way I approach that is I really want them to do what they want. So I need to make sure they know agenda and trying to make them to come on hospice. No agenda. Here's why. Like, I usually try to talk to them about why I think hospice is great. I think it helps that I was an ICU nurse for many years. So I can say, I've done both sides of nursing. I want you to know that this is about what you want. I truly have no agenda to make you or get you to come on hospice. I am truly here to see what's best for you. And if this person really doesn't want to stop treatments or really does need to do a couple things like get a PET scan or get a drain placed or something before they come on hospice, I would advise them not to go on hospice. Now, if it's someone who I really think needs it because I feel like they're going to be dying in the next couple of weeks or so, and I'm trying to help them see that this will be helpful, I will try to talk about the end of life journey. And that is how I word it. We all have our end of life journey. I will have one as well. I would say to them, you, per what the doctor is saying, are on your end of life journey, and you are getting close to that. If you know that, how do you want that to look? Do you want to be in the hospital or do you want to be at home? And guess what? If they say to me, I want to be in the hospital, I'd say, okay, then the hospice isn't for you. And I would, hey, someone just gave me money. Thank you. I didn't know that was a feature on YouTube. And I would just say, then you shouldn't go on hospice if you want to be in the hospital and die, because that's what you should do then, be in the hospital. And if they say, I want to be at home, then I say, okay, well, then this is how we're going to help you. And then I'll start into how hospice can help while they're at home. So that is how I would do it. In so many words, everyone's different, right? You have to read the room. You have to figure out who's doing what, and you can't, and I want people to do exactly what they want to do. Thank you, everybody who's coming in here and saying wonderful things. I appreciate you. Is it normal for a patient to feel closer to loved ones? Oh my God, Laura. Is it normal for patient to feel closer to loved ones? Oh my God, I thought you meant nursing. I'm so sorry. So sometimes as a nurse, I feel closer to the family than I do the patient, just because I get so close with the family. Is it normal for the patient to feel closer to loved ones? I think so. You mean like if they weren't really close before, but now they are? I think that's normal. Yes. We were distressed when they wouldn't give my father water when he was dying. Would this have prolonged his life? He couldn't swallow well, and they used swabs. Nadine. Yes. So, Nadine, here is the thing about that. If someone can't swallow water or can't swallow or having issues swallowing, the first thing that they will choke on is liquid. So, trying to give him water would have caused him to possibly choke to death. And I don't mean to be graphic, but I need people to understand that, because that is why nurses will say, no, he can't have water. Even though it seems like, oh my gosh, who cares? Just let him have water. But it's because they probably have witnessed, and I have myself, people giving people water anyway, even when they can't swallow. And then sometimes it's okay, and sometimes it's not. And when it's not, it's really awful, because they basically choke to death. And that's really scary and awful for everybody. So you have to use those green swabs. So when someone can't swallow, but really is having a hard time with dry mouth and they are uncomfortable, I use the swabs with ice cold water is the trick, I think. Ice cold water. I get really cold water and put tons of ice in it, and I dip the sponge in it and really try to moisten their mouth up, or even try to use ice cubes or have them suck on popsicles. That sometimes helps, but that is probably why. Sometimes if someone really wants water and they have issues swallowing, I'll try to sit them really high up and try to get them to take some water to see how well they do it. But sometimes you really have to be careful, because you don't want those last moments with your loved one to be of them really struggling to breathe because they just swallowed water into their lungs. So that's probably what was going on there. I'm really sorry. It has to be hard. Hello, I have a question. My mother died a few weeks ago. Thank you for being here. And for about a month before she died, she said she kept seeing people all dressed in black. She had dementia and Parkinson's. Was that normal? So yes, that is normal for dementia and Parkinson's. Now, if she wasn't distressed by it, I would say go for it. If she's okay with them being, for some reason, I picture like people dressed in black would make me feel scared. I don't know, but maybe she wasn't scared. But I will say visioning is normal at the end of life, seeing people, but it's usually very relaxing and loving. And it's not usually people you don't know dressed in black, right? So if she was comforted by them, maybe that was visioning. If she wasn't comforting by them, I would say dementia and Parkinson's specifically tend to see things like that, or they'll see little children, or they'll see dogs, or they can have kind of scary visions, specifically with dementia and Parkinson's. I hope that helps. So we don't know exactly why, but we just tend to see it a lot in dementia and Parkinson's patients. I haven't seen a spirit leave the body, no, but I will say when you're with someone who has taken their last breath, the energy in the room changes. That's what I think. That's the thing that I feel. I don't see anything, but that's what it feels like. My husband's heart is pumping at 20% with low blood pressure. Is it time for hospice? Vicky, I would ask you to talk to his cardiologist, which you probably should have if he has a pumping heart of 20%. Talk to his cardiologist. I only say that because I feel like if I blanketly said, yes, he should go on hospice, or no, he shouldn't, is not really fair, because you really need to look at, especially with heart disease, you need to look at the whole picture. You need to look at a whole big thing. I need to know all of his history. So in just one little sentence like that, it wouldn't be fair for me to answer that, because I could be misleading you. So I would talk to his cardiologist and see what they say. Yeah. Thank you, everybody. I'm just reading the questions here. Jay Bloke says, I'm going to try to answer this. It might be a little tough, but I'll try. So my father-in-law felt dead on the breathing machine. So his father-in-law was on a breathing machine. Then they had to turn off the breathing machine. Was he still alive? So, gosh, I'm so sorry, Jay. I would have to have been there. So, yes, he was still alive while he was having the breathing machine. The breathing machine was probably keeping him alive. When you unplug it, like they say, like you said, that they pulled the plug or whatever, sometimes people will still stay alive for a little bit. It takes a while for their body to fully shut down. So I don't know what happened with your father-in-law. Maybe some people die immediately because their body can't survive without the machine. Some people's bodies can survive without the machine, and but it takes a while for them to eventually die. So I don't know. I wasn't there. I'd have to be there to actually know. Hi, I would like to know, do people ever see something that is scary to them at the end of life? Around their death. Yes. Okay. So do people see scary stuff? I haven't been around every single person who died, right? So I can't say for sure, no one ever does. However, I can say from my experience, I have not witnessed people seeing scary things like the devil, right? Or demons or fiery flames or anything of that sort. I've never, ever seen that. My shirt, like, look at this. I swear, I just like this shirt so much. I refuse to get rid of it. Anyway. But I will say that delirium, paranoia, ICU psychosis, Parkinson's, dementia, those things can cause people to be agitated, paranoid, and feel scared and feel like someone's after them or something bad's happening, right? So that can happen because of those diseases, not necessarily because of death. I have a question regarding medications. Why are some physicians not wanting to give pain meds to people in hospice? Oh, Sherry. I could just get on a soapbox about that. So I, thank God, have never ran into any hospice that I ever worked for. We have never had that problem. Never. We are aggressive as hell with our pain management, as it should be. As it should be. So I would say there are physicians, at least from my experience, right? There are physicians who don't want to give a bunch of pain meds to people who are not on hospice because they're afraid. They're basically like saving their own butts because they're afraid to cause any harm. Now on hospice, it's not that we're not afraid to cause harm. We just know that the most important thing is their comfort. So that's what we're going to go for. Now I will say I've heard other states have been really cracking down on narcotics, even on hospice. Thankfully, California is not like that, but I think it's awful. Okay, Nadine, there you go. So Nadine says, I have a terminal illness. I'm scared of pain when I die. I have heard doctors can't take away all the pain. So here's the thing. I mean, I really think we're like amazing at controlling pain. So I think you need to keep always asking for what you need. And yeah, sometimes if you've had here's the thing, right? If you had this terminal illness for a while, right? Because you can have terminal illnesses for a while. If you've had a lot of pain already and you're already taking a lot of pain medicine and it's hard to manage, that may continue. But usually once you're on hospice, they're much more aggressive. We can do all types of things. We can try methadone. We can do CAD pumps. We can do all types of stuff. And a lot of people don't have pain at all when they're dying, just FYI. Now, if you've already had a lot of pain, we'll probably have to up our ante with you and try to make sure we can control the pain. So I would say we do control the pain for most people. But what it will take sometimes is some time to control the pain, right? So between that time when we haven't actually got it covered, you may suffer in there, right? Because we haven't got it figured out yet. So that's the hard part. But I feel like California, we're pretty good. I only say that because I've never worked at anywhere else. So I don't, at any other state, you know. Hey, everybody. How do patients show they are in discomfort? Oh, that's such a great question. So people ask me all the time, how do you know they're not in pain, right? If they're unconscious, and people will get like mad at me for saying, don't worry, your loved one's not in pain, they're okay. And they'll be like, well, how do you know? We know, so not just me, anyone in the healthcare field can read signs of nonverbal pain, and we're really good at it. We're really good at seeing and understanding nonverbal pain. So I don't really go by vitals, but say they're in the hospital, you can go by vitals. Increased tachycardia, high blood pressure. So I don't ever look at that, but you could do that. What I look at, it's like a baby. If a baby is fussy or teething, you know it. You know what I mean? Like they are fussy, they're not sleeping, they're restless, they're ornery, they're crying, they're moaning, they're all over the place. You know your baby's not doing well. That is how a dying person acts if they're not okay. That's why when they're not acting like that, we know they're okay. If someone is not okay, even if they can't speak to you, even if they're like almost fully unconscious, they will show you through signs in their body. They will be guarded. If you touch, say they've been unconscious for days, no food or water, not waking up, not making eye contact, but you go to touch them and they do one of these, they're probably in pain. So we look for stuff like that, or we look for a furrowed brow, or we look for, if you touch them even a little bit, do they feel relaxed or do they feel tight? And they also will moan or make noises consistently. Now, sometimes, side note, sometimes people will actually go like a rhythmic thing. And I do think that is more of a self-soothing mechanism than actually pain. But that was a long-winded answer to, we are trained to know what nonverbal cues look like, and we get really good at knowing what they are because we see it day in and day out. And we can see what comfort looks like versus someone who's not comfortable. Hope that helps. Thank you, Kathy Lee. Thank you, everybody. Okay. I lost my husband when I was 30. Oh, he thanked me over and over for moving all over the country and abroad with him for his job. Very nostalgic. He died that night of a sudden cardiac death. Did he sense it? You know, of course, I can't say for sure, but I do feel like sometimes people just know. Sometimes people just know. Okay, so Dan says throat cancer is something I saw 2 times. One lived for 22 years, one was 6 years. That's a good. Thank you for letting us know. Oh, Christine, I'm so sorry. It's really hard for me to give suggestions because it borderlines medical advice. I have to be very careful. Like I have a lot of suggestions, but a lot of them are for like medications and stuff, and it gets too close to me, like giving medical advice, and I don't want to do that. So my suggestions are, if you're having a hard time with these symptoms of late stages of Alzheimer's, to really work with the doctor to be like, hey, we got to do something about this. This is not working. We have to try something else. And know that it just takes a while for sometimes for these medications to work. So it can be a slow, very annoying process. Hi, Julie. I'm witnessing my aunt decline with end-stage COPD. She has begun to turn down her O2 because she feels like it's too much air. Oh, Brandy, you know what? It's okay. That can happen with COPD people too. I mean, I don't know if she's on hospice or not, but if she is on hospice, then I would go with boss, and she can do what she wants. And if that makes her feel more comfortable, go for it. And if it does, you know what I mean? Like whatever she wants. Whatever makes you feel more comfortable. Greta, thank you so much for being here. Thank you so much for being here, Greta. Wow, thanks, Kate. What can we do to help make the passing of someone with dementia calmer or more peaceful? Shanna. Oh, yeah. So, see, it's tough. So, with dementia, people can live 7, 10, sometimes 15 years with dementia. So, that span of time, you're going to have a lot of moments of agitation, confusion, and it's tough. Now, once they get to the time when they are actually dying, when they're getting close to the end of life, maybe a couple months, not always, but a lot of times, they are calmer than normal because they're sleeping most of the time. So, how can you help? Basically, by not forcing anything. Don't force them to eat. Don't force them to get up. Don't force them. Just don't force anything. Don't force them to take meds. You keep them clean and you keep them safe and you keep them comfortable. You offer a bunch of stuff, but if they don't want it, don't force it. And that's how you can help keep someone with dementia calmer and more peaceful. It's very generalized, but in general. Thank you so much, everybody, for the compliments. Deb, thank you. I love you. Okay, let's see, Allison. After my mom died, ER had used paddles and meds. Her chest kept going, moving up and down in a breathing pattern, balanced. Why? Is it a rhythm as if she was breathing? Okay. So I don't know if she had died already, Allison, but what that just, first off, that's really traumatic, and I'm really sorry that if you had to witness that. So what you were probably witnessing from what I'm reading is something called agonal breathing. And this is really important because it can happen in situations like that where someone's trying to be resuscitated with being shocked and CPR and things like that. And then it will happen too during the actively dying phase of someone dying a natural death on hospice. So the very, very, very end stages of death, we have something called agonal breathing. And agonal breathing is an automatic response that our body does, almost everyone's body. And it's not actually a breath, it's a reflex. And they're not actually breathing. It just looks like they are. There's actually not any air coming in the lungs. It's more up here. And their whole chest will move and everything. But they're not actually breathing. It's called agonal breathing. They probably shouldn't put the word breathing at the end of it, but it's called agonal breathing. So that's probably what you were seeing. I can't be for sure, but that's what I would think. Question, do elderly improve a few weeks before passing? My aunt improved, more energy, more memory for a month or so before passing. This happened with my dad as well, normal. So, Rick, hopefully you're still here. You know, there's a thing that I always talk about called the rally. The rally, it's actually called terminal lucidity is the real name, but it's called a rally. And it happens in about 1/3 of all of our hospice patients or palliative care patients where they get a burst of energy, where they feel so much, they kind of act like themselves again. They start eating, they start maybe even having more energy and getting up and walking around, depending on their weakness level, right? But it happens in 1/3 of patients. They get this burst, they feel better, they look better, they do better for a few days to as little as a few hours, max few days, and then they suddenly die. And it's sudden. Down, 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 burst of energy, die. Now that is what normally happens in 1/3 of all of our patients, so not that many. But this seems a little different because she was better for like a month. So that is probably just the waxing and waning of someone elderly. That's really people who are elderly. I just see, their health kind of waxes and wanes. And the reason why I say that is because it wasn't the rally doesn't last for a month. So someone won't feel good for a month. They'll only feel good for probably max a few days. Mm-hmm. Thank you, Sherry. Oh, thank you, Debbie. Okay. After my mom died. Oh, yeah, Allison. Okay, good. I already answered that question. Hello. You mentioned about the U.S. having certain states that are legal for euthanasia. Can people go to the states before looking? Yeah, you know what, Arlene? I don't actually know the rules about moving to a state where you can do the medical aid in dying. I bet Canada would be a little more be easier to do it with, because Canada you can also do it. But if you are curious about that, go to deathwithdignity.org. I bet you they'll be able to answer that question. Oh, Tara May, I didn't see your first question. Tara May said, Julie, do you have any tips on what to do? But I missed the first question. Shoot. Okay, I'm going to go all the way down to because I'm missing so many questions. I'm so sorry, you guys. Let's see. Yes, I'll be doing more lives. I will try to do one like once a week, and then I'll post it on the page too. So if you miss it, you can always go back. Oh, Julie, here we go. Julie, have you had a loved one on hospice? I had to put my husband on hospice. It was totally different experience being a loved one and a caregiver. It helped to be a better hospice CNA. I have not had a well, I mean, all my grandparents were on hospice, but I wasn't very close with them. So I have not had a loved one on hospice. I have had loved ones very close to me die, but it was more of it was very quick and not a hospice situation. It was like accidents and things like that. So I have experienced like deep, deep grief, but not through hospice. So it'll be curious. I mean, I'm sure I will, I'm sure I will. So it will be curious. Julie, I have a question. Oh, Scout, I hope you're still here. I have a question. What does it mean when pink foam appears from a patient after a patient passes from bile duct cancer? You know what, Scout? To be super, super honest, probably not much. Probably not much. So our bodies have fluid, all types of fluid. The foam, whether it's pink, I don't know. The foam can be. So first off, we have like fluid, right, in our bodies, and we also have sphincters that are supposed to keep fluid where it's supposed to be. And when we are dying, and especially with bile duct cancer, you're going to see more. You're going to see more of this. So you could see green fluid with bile duct, yellow, brown. I guess pink. I mean, I'm not sure what the pink meant. It probably was like clear, then mixed in with something. Who knows? But I feel like when people die, not I feel like I know, sphincters can relax, so fluid can come up the mouth. Fluid can come out of your anus from your rectum. It can come, so it can. It's like, unfortunately, there's no black and white answers a lot of the time. And that can be really hard because I love to live in the black and white. I want to know everything about everything. I want to know the answer to why about everything. And with death and dying, especially if it's on hospice, you don't always get those answers. And even if you ran a bunch of tests, what is this? Where did it come from? Why? It probably still wouldn't tell you much. And so the reason why I say all of this, I will promise I'll get around to how hopefully I can help you. The reason why I say all of this is why I am here talking about stuff like this, because the more we normalize the strange things that can happen at the end of life and say, hey, we don't know exactly why this happens, but we know it does. And death, it's kind of all part of the death and dying process. Fluid unfortunately, comes along with the death and dying process. Not always, but it does. It does enough that we should talk about it. And foam, pink or brown, coming out of the mouth can happen a lot with congestive heart failure patients, bile duct cancer patients, because they usually have a lot of nausea and vomiting and hiccuping and irritation and stuff anyway. So I see it a lot with those types of patients. I also see a lot of symptoms with bile duct cancer patients. So I'm not sure how your loved one or your patient or whoever this was. I think it said after a patient. Yeah, who they were, but I feel like I see a lot of this with those type of cancer patients. So I don't know if it's like things aren't being processed in the stomach and they're not being digested, so they're regurgitated. But I do see it a lot. I hope my air conditioner is not too loud. Oh, perfect. Is death by dehydration painful without medication? Thank you so much for asking that question. No. So the person probably is never dying from dehydration. Unless they're literally like lost in the desert and they die from dehydration, that would be painful. And really, it wouldn't be painful the moments before they die. It'd be painful the drawing up to it, because they're a healthy body that's being dehydrated. So that would be painful. At the end of life, when someone's dying from something else, a disease, dementia, they can't eat and drink anymore because their body won't let them. Cancer, the cancer's overtaking their body and their organs are shutting down. CHF, their heart's no longer working, so it's shutting everything else down. That's what they're dying from. And because they're dying from those things and their body knows biologically that the body's shutting down, the body starts preparing itself and turning off things like thirst. Now, some people will say, no, my dad was super thirsty. That doesn't mean that we can still give them what they want, for sure. If they're asking for water, if we're trying to soothe them, yes, of course. But as far as like actual hydration, they do not need it. Their body will not want it, and their body will not even know what to do with it, even if we gave it. It would fluid overload them and make them feel worse. So dying, you're going to be dehydrated and you're going to feel better. It's not going to be painful because you can't eat and drink. That's a fact. I hope I did a good job at explaining that. I might not have. I have tons of videos explaining it. But now, you said death by dehydration. So if you actually mean someone like in a desert who is perfectly healthy, who just lost their way and couldn't find water, yes, that is painful. But if we're talking about hospice patients here, no. And they're not dying from dehydration. No hospice patients dying from dehydration, even if, yeah, they're just not, because they're dying from a disease. They're not eating and drinking because they're dying. They're not dying because they can't eat and drink. Does that make sense? If I said it right, sometimes I even confuse myself. Oh, you love my shorts. Thank you. I know I need to start doing more of them. Are the dying less afraid of death than the living? Well, it's funny because we're all dying, but I guess if it's imminent and they know they're dying, I feel like most people come to terms with it. They really do. And I feel like that's what inspired me to do this, is because I saw the people who were willing to talk about hard things, and even the ones who were willing to say, I don't want to die, seem to live better and die better, even though they didn't want to. So yes. Hi, Julie. I had someone once tell me that morphine gives people nightmares, hallucinations while they are awake. Is that true? Cody, it can be true for some people. Not everybody, though. Some people love it. But no, some people can have adverse reactions to it, and we'd have to try something else. Do I believe in heaven? I believe in an afterlife. I feel like we can use the word heaven but I feel like that makes it seem like I believe in a hell too, and I don't. I believe when we die, we come to, or maybe not even have a moment of, we kind of transition to a place that we've always known, and that place feels more like home than this place ever did. So if that's heaven, all right, baby. I think it's just easier to call it heaven because we're used to that word, but I don't know. Do people confess their worst secrets? I wish I had the tea. I wish I had the tea. But no, they don't. Oh, I see. I'm sorry, guys. What's the strangest request a person has asked for? People must not have asked for strange things because I can't think of it. I can't think of anything. You know what I mean? So I must have, but of course that doesn't really say much. I have a pretty bad memory. Okay, Donna, I'm going to give me 1 second. Just tuning in and not sure if you've answered this, but do most patients in cardiac arrest not make it? If they do survive, is life not always worth living? So it's really hard for me to answer that because I don't work in emergency medicine. So I have helped people in cardiac arrest before, but I can't answer with like true authority if most people make it or not. I would say if you're already sickly, I would never do CPR. Like I would never suggest someone do CPR if you're already really ill. So people on hospice and stuff, I would never suggest they get CPR because they most likely won't make it. And it's a lot of pain to go through that. All right, you guys. Whoa, I've already been on for 42 minutes. Oh, please explain the single tier. Okay, I'll answer this one last question and then I'm going to go. And then I post this to my page so you can always rewatch it. Please explain the single tier. So we do think the tier thing that happens at the end of life, sometimes people having a single tier or a couple tiers, is a biological response and not an emotional response. So first off, people's eyes are either closed, so they can be closed, they can be fully open or partially open. Because of that, they're not really blinking at all. So fluid is collecting under the eye, one, to either protect it because the eyes are open, or two, just because they're not blinking, but there's moisture underneath the eyes. And then the moisture collects and then tears fall. So that is why we think that. We don't think it's an emotional response. All right, you guys, I'm going to post this on my page. Thank you so much for tuning in. And some people gave me money too, which is like so amazingly nice. Thank you very much. And that's it. I'm on YouTube. I'm on Instagram. I'm on TikTok at Hospice Nurse Julie or Facebook. I'm on all of the things, wherever you guys like to get your information. I'm going to try to go live about once a week on TikTok. Not TikTok, on YouTube. Where am I anymore? I don't know. All right, you guys, you're the best. Thank you so much. Take care.